The last straw for me was I was referred to a GI specialist. I went in there. I redid the H. pylori test. It was negative.
Mm-hmm.
And his suggestion was that I should do a colonoscopy.
Oh my gosh. Welcome to the show. I am your host, Anya Fombat, and I spark the hard conversations that challenge questionable cultural and societal norms that threaten the well-being of the African community. And I also share stories about growing up as Africans in Africa and in the diaspora. I strongly believe that normalizing open discussions and sharing experiences, whether good or bad, will not only make you find your voice, but will broaden your sense of purpose and empower others to do the same. So if you have ever tried challenging certain African cultural and societal doctrines, or if you have ever felt like it is about time that we confronted these issues in our African community and do better as a people, or even if you have always been interested in learning about the experiences of other Africans growing up in Africa and the diaspora, then you are in the right place. Welcome to Living African. Hello, everyone. Welcome to another episode of Living African podcast. I am your host, Anya Fombat, and I am here with a good sister and friend, Ndoping. Now, today we will be talking about fibroids, which seems to be a recurring topic on this platform. And I decided to keep this conversation going on fibroids because as days go by, I have discovered, and I still discover, that there are many more women who face challenges with fibroids than it is spoken about. To me, honestly, out of all the health issues that, I have been aware that are common to the African woman, I feel like fibroids is the most popular, but the least spoken about. So I have made it a mission on this platform to bring this topic as often as I possibly can, because I feel like many more women have to feel comfortable talking about it, and we have to take away the stigma that surrounds fibroids. Because I've also come to learn that when a woman says she has fibroids, the first thing everybody thinks about is her ability to conceive, her ability to have children. And maybe some men may get scared of that and shy away from pursuing a woman who has fibroids and stuff. And I want to really debunk that narrative, because that is not true. You can still have fibroids and have children and have them normally without any kind of intervention. So I just wanted us to further discuss this topic and give various perspectives with respect to it. And I'm super excited to have Mane on here, who will give a very unique approach and perspective to fibroids and how she handled that situation. So I want to welcome you here, Mane. I am really, really excited to talk with you today. How are you doing today?
I'm doing great, actually. And thank you for this opportunity to share my story and to say that this is the first time that a lot of people will be hearing that I have been challenged with fibroids since I was initially diagnosed in 2014.
Yeah.
And I think you probably are one of two people aside my immediate family to actually, hear the story, because all along I've been like, you know what, this is my story and I got to handle it the best way that I can.
I know. Wow. So to say I'm honored is an understatement. And I know that I will definitely identify with parts of your story as someone as well who has suffered with fibroids as well. So I look forward to actually learning a lot from your own experience and being inspired as well. Now let's take it, a few steps back. Can you introduce yourself to our guests to know more about you and, just about you on a personal level?
Okay, so my full first name is actually Manenke, but I go by Mane because it's the short form of the first name and it's easy.
Yeah.
So it's Manenke Ndoping, originally from Cameroon. I moved to the US in, I can't remember the year, but I was 18 when I moved to the US.
Mm-hmm.
Undergrad, I studied psychology. And the reason I'm actually mentioning that is because that journey actually helped me to manage the challenges I came to face when I learned about, certain health conditions. So after an undergrad degree with psychology, I moved on to get a master's degree in occupational therapy. So I have been practicing as an occupational therapist for 6 years. And in the course of that journey, it has been a continuous learning journey from, undergrad in psychology, practicing as an occupational therapist.
Wow. Thank you so much for sharing. Now, how did, you come about being diagnosed with fibroids? Like, what warranted you to check yourself? Like, what actually happened before we came to that realization that, hey, this could be fibroids?
Okay. So in 2000, when we initially came to the US, we had to do these, how do you call it? I think it's wholesome checkup where they had to check a bunch of things in order to get us into school. But when I came in, I think I was 17 or 18. And initially they thought I would be going into 12th grade. But when I was screened out, I went straight into college. Well, so we had to do all this tests. And then the person who did the test, the doctor who did the test, he said, I would recommend that as a wellness checkup, do an annual physical, which is something which back home we don't have or we don't do. So that is one thing that stuck with me. So in the following year, I did my annual checkup, 2008 and 2008, 2009. I can't remember the exact date, but I know I moved to a 4-year college in 2009. And I used to have these frequent headaches, and I could not understand why. Now, as someone who was interested in the healthcare profession, my initial thought was, oh, do I have a brain tumor? And I was like, no, I haven't done my annual physical for the year yet. How about I go do it?
Yeah.
So I did go do it. And then they found out I had low blood sugar. So my primary care at the time was, well, just have like candy bars, ready to eat when you feel like your sugar is low, or eat it 2 to 3 hours after your meals so your sugar doesn't drop too low before you get to eat it. So now as a young person back then, excited about the past to just, eat candy because, hey, it's the doctor said. So that's what I did. But I found out it wasn't helping me because I would eat maybe breakfast or lunch. Then 2 hours later, I'm looking forward to eating the candy so I don't have the headache. But then thing I later learned about chocolate, especially if it's not dark chocolate, is that it raises your blood sugar and then it drops. So you have the sugar high and then you have the sugar crash. Now, because I did not want to feel that sugar crash, I kept eating candy until it was time to eat my next meal. So I wasn't, and it was kind of affecting my school because I can't study if I have a headache or if I'm having a sugar crash. So I said, okay, there's got to be a way out of this. How can I manage my blood sugar without, having this whole one-on-one with candy?
Yeah.
So back then, a Google search, they were like, you have to do a sugar detox and blah, blah, blah. So I did one, which was, to fade off the candies and increase my food intake.
Yeah.
So I came across a research. Well, it wasn't scientific. Back then, I wasn't, going based off of scientific research. I was just going off of something that could help me at the moment. So I came across a lot of personal stories of, getting rid of candies and increasing food intake. So I did that for like a weekend. And to say that the detox was crazy, it was crazy. But I was able to fade that out and increase food intake. So that sort of helped me manage my blood sugar. So the following year, I did my annual physical again. And the annual physical this time included an annual pap smear, annual women wellness, which involves your pap smear and all of that. So the results came back that I had abnormal pap smear. And the next step was to do a biopsy. So when they did a biopsy, the doctor, the GYN who did it, he gave me a pamphlet that on the cover page, it was like a trial medication that was going on for women who could either have abnormal pap and were possibly diagnosed with cervical cancer or something along those lines.
Yeah.
And the ingredients of that trial drug were like cruciferous vegetables like cabbage, kale, and all of that. So the doctor was like, review this while we're waiting for your results. So in my mind, that was scary because I'm like, what? In my late teens, and I'm getting a diagnosis of possible cancer. So with that information, I went on to do my research about the benefits of, cruciferous vegetables. And I said to myself, well, hey, what's the worst that could happen if I start including these foods in my diet? At least it would put me at a better chance of healing or getting better if in case that turned out positive for whatever they were looking for.
Yeah.
So at this point, I didn't tell anybody about it because my family is a bunch of healthcare providers, and I was struggling to deal with that information, and I wasn't ready to receive other info. So I was like, okay, let me wait for the results. If it's positive, then I can decide how to share it, right? And say that it's a possibility. And then I'm already scared. And then hearing from other people will be more scary. So long story short, results came back negative. But because I had an abnormal pap, the recommendations back then, I don't know if it's still the same now. The recommendations back then is if you have an abnormal pap, you have to do it every year for the next 3 years. Mm-hmm. And then if they all come back normal, then you go back to doing, there was every other year.
Every other year, yeah. Mm-hmm.
Yes. So when it came back, I did it 3 years, it came back negative. So I was cleared to go for 3 years without doing it. But then, so because of that experience, I became more in tune with my health or with my body. Mm-hmm. So if something wasn't feeling right, then I become curious. I was ready to Google anything, any symptom, but then it wasn't doing me any good because I'll be
hypochondriac. That's me right there.
So I had to, like I said, I did psychology undergrad. So learning about the mind kind of helped me deal with the whole thing. Sometimes I would tell myself, well, maybe it's all in my mind or maybe it's not. Mm-hmm. So the next symptom I noticed in 2012-ish, that's the year I moved out of state to grad school. Mm-hmm. I started to notice that my lower abdomen would be distended, easily get bloated and all whatnot. So I would Google it, and what I came across was, well, the foods you're eating is making you gassy, or hormones are all over the place, you're in childbearing age, blah, blah, blah. But then I went for my annual that year, and then my doctor recommended an ultrasound. Mm-hmm. So that was 2014. The results came out. She was like, oh, you have fibroids, but you don't have to do anything about it. So now I remember my mom had it and she had surgery for it. Yeah. So when she said that word, it was almost like I went into a trance. But then she made it sound like it wasn't a big deal. Mm-hmm. But I'm sitting there like, why don't I have to not do anything about it? Because my knowledge about fibroids prior to then was that it only happened in women 50 or 60 and older. Mm-hmm. It wasn't a young person thing. So I had all these thoughts running through my mind. And I asked her, like, what, is there any reason why I had it so young? I'm like, what, early 20s? Mm-hmm. And she said, oh, no. And then she walked away. And then she came back and she was like, are you okay? I'm like, no, I'm not. She said, okay, what is your fear? Now, in my mind, my initial thought was, like you mentioned, the story is that if you have fibroids, you can't have kids. Yeah. That was what I was feeling, but I didn't say it. And then she pulled the chair and then she sat down. And then she said, are you scared that you might not be able to have kids? I said, yeah. And then started tearing up. And she's like, oh, no, you're fine. Women carry kids with fibroids. They choose to take it out and still get pregnant. But she didn't make it, she made it sound like it was, it won't bother me if I don't bother it. Pretty much that's what she said. Mm-hmm. So I left the office with the paper. That was the first time I started requesting from my physical results and all of that because I wanted to keep track. Mm-hmm. So I got into my car and I sat there for cried a little bit. Then I drove home. But I didn't tell anybody about it. So this is 2014. So it wasn't quote unquote bothering me besides the fact that my stomach was distended and I was always bloated. Right. So fast forward to 2017, this is 3 years later. In November, I think it was the first weekend in November. So I worked, this was my second year working as a therapist. So we usually have this tradition where we order food for a coworker who has a birthday and things.
Mm-hmm.
Now, around that year, I had started learning because the bloating issue was getting to me, right?
Mm-hmm.
I mean, I'm not really a person who wears like form-fitted clothes and things like that. I'm into more like a t-shirt, pants, dress shirt kind of thing. But I didn't like, because I felt uncomfortable.
Yeah.
So researching about foods that cause bloating and blah, blah, blah. And so that weekend I worked with other Chinese, and that same week I learned about MSG in food and, the possible. So now I don't know if it was my mind playing tricks over me. So after I ate that Chinese food, I started having very uncomfortable pain. It went for like 3 days. So the third day was a Sunday. I said, no, this thing is not going away. So let me go to a walk-in clinic. So I went into one. The doctor kind of like, he just ran his fingers down my chest and I flinched because it was hurting. And he said, oh, you have appendicitis. Your appendix is about to explode. You need to get to the ER right now. And I'm looking at him like, okay, I know where my appendix is located.
Mm-hmm.
But he's the doctor, so let me not fight him. Now, because I had an experience with emergency, whatever, that kind of traumatized me. I said, okay, if I could tolerate the pain to drive to the clinic, I can drive myself to the ER,
mm-hmm.
which I did. So I get to the ER, it's 11 p.m. on a Sunday night. The next day I had to work. So I get in there, they take my blood pressure, and it was really high. And the lady was like, oh, you have high blood pressure. You should take this medication. And I said, I don't have a high blood pressure, but my blood pressure is high because I'm in severe pain and I'm anxious.
Pain, yeah.
Yeah. So she looks at me like, why am I sounding like I know what I'm talking about? But then she walks away. Then she comes back and she's like, okay, we have a bed for you, change into your robe, and somebody will be there with you. So they set me up to put, monitors and all of that. And my blood pressure starts to go down. She comes in, she looks at me, and then she walks away. So they scheduled me for a scan. No, before they scheduled me for a scan, the doctor came in and he said, no, it was a lady, it was a physician assistant. She came in and she said, you might want to let your family know in case you're going to go in for surgery.
Mm-hmm.
And I'm like, surgery for what? But that was me thinking, I didn't ask her that. But I was like, okay, if it turns out it's really my appendix, because at this point I had not told anybody that I had been to patient first. No. So back then, I think WhatsApp wasn't a thing, but my parents and my younger brother, we had like a WhatsApp group text.
Mm-hmm. So
I just dropped a message there about, okay, I'm at the ER. I might go in for surgery for appendicitis. That's all I said. So they came, they scanned, they did a CT scan or MRI. I don't know what that was. Then I went back to the bed. Now, mind you, at this point, I have not mentioned anybody about fibroids. So I'm laying in the bed and then the physician assistant comes in. Now, this part kind of offended me in the sense that as a healthcare provider, before I provide any kind of information to my patient, and if I walk into the room, I would always ask who the people there. Not like I was trying to hide it from my family, but I wanted to be able to explain it to them, not for them to hear it like that.
Yeah.
So this lady comes in, she's like, oh, your results are out. It's not your appendix, but you have fibroids. And you should follow up with your physician assistant. Somebody will give you pain med. I'm going to send you home. And I'm like, so my mom is looking at me like, now, the consolation to me was, okay, they were hearing it for the first time. So maybe to them, I'm just getting diagnosed.
Mm-hmm.
But I had known about it for 3 years, but all I was told was, do nothing about it if it doesn't bother you. So the guy brings the pain med. I take it. I drive myself home. By the time I get home, it was like 2 a.m.
Mm-hmm.
So I took the pain. Well, no, I took the pain med when I got home because I think the medication makes you drowsy.
Yeah.
I didn't want to take it and then have to drive. So I drove home, took the pain medication, went to sleep. Woke up 5 a.m. and I texted my boss that, I can't make it to work. Then my phone, I can't remember how many missed calls I had. One of them was my grandma. So I called her back and she said, now what's how you come up with for people that sick? And I was like, oh. So I understand where she was coming from with that, but the way it hit me, I was like, that's what she's thinking. Because my parents didn't say anything in the house. So I'm like, if that's how she's thinking, then people of her time or her era thinking that way.
Like that. That's true.
But even though I knew that women with fibroids still have kids, I wasn't in a space to explain that to her. Mm-hmm. Or I didn't even think that she would understand it. Mm-hmm. So when she said that, I was just quiet. So she said, okay, my pikin, sleep you. We'll go sleep for a weekend. Couldn't go to sleep. So from that time, the stories were, oh, hurry up and have kids, or you might not be able to have kids, or blah, blah, only within the family. And I'm like, oh, okay, if I have to deal with this coming from within the family, well, what more know the world out there? So more reason why I didn't tell anybody, my closest friends, closest cousins. I was like, I'm not ready to deal with that information, from outside people. So that's how I relearned about fibroids, because it wasn't the first time for me, but it was the first time.
Right. Wow. You really said so much that I could personally identify with, and also, not only personally, but also like from the whole stereotypical level, about women having fibroids who are not able to have kids. And then also, the change in the times, like people of the previous generation, how they communicate and stuff like that. Sometimes it could come off as insensitive, even though they're coming from a place of love and they probably don't know better, so dealing with all those things, and then also with your own fears, because regardless of whether you know the truth or not, sometimes when someone raises a concern which may be faulty, it actually adds that anxiety and fear in you, even if you know that it's not true, you still just have that feeling like, oh my God, this is a possibility, So let's take it from 2017, I believe that's when you had that ER visit. Now, after that, how was life for you, trying to live and deal with fibroids? Like, did you have any other follow-up visits with the doctor? What therapy did they recommend? What worked, what did not work? And like, basically, how did that whole experience also impact you emotionally, mentally, and even with the relationships in your life?
Okay, so after that, when I left the ER, the physician assistant said I should follow up with my primary care and GYN. So when I woke up the next day, I called my primary care and I got an appointment. And then when I went in, she referred me to a network of GYNs. So the first GYN I saw was a guy, and he kind of confirmed what I was thinking. And my thought was that, given the location of the fibroids, I did not think that was what was causing the discomfort. But like I said, it's not my area of expertise. So it was my thinking, but I didn't voice it out. So when I went to him, that's what he said. But I wanted a second or third opinion, either to confirm that or to lead me to a different direction. Mm-hmm. So I saw another GYN, who is a guy. Actually, this network was like a siblings, two brothers and a sister. Mm-hmm. So I went to the other guy, and he said, oh my God, you have to get it out. You have to get it out now. And in some cases, the women have to take out their uterus. And I'm like, okay, thank you for your opinion.
Right.
Then I went to the woman, and she said she could refer me to like a pelvic floor specialist to do pelvic floor exercises. And based on my knowledge of pelvic floor exercises, I thought that it was only for women post-birth to kind of strengthen. That was my thinking. Mm-hmm. So I said, okay, maybe let me try that and see if it helps with the pain. But the pain, I think I tried to schedule a couple of times with the therapist, but I didn't actually get it going because either she would reschedule or I would reschedule. Mm-hmm. So I set out to do my own research again to see how I could help myself while waiting to actually, get to see the therapist. Mm-hmm. So I think my insurance changed because I was on the Obamacare thing where you could stay on your parents' insurance until you were 26 or something. Yeah. So my insurance changed. I was still in grad school, so I didn't have insurance. So I had Medicaid, but it only covered, certain things. Mm-hmm. And I think it covered my my primary care. So I went back to her and I said, I'm not the expert, but I feel like something else is causing this discomfort. Yeah. She had me do an H. pylori test, which came back positive. And to me, I was like, something else is the issue and this is what it is. Yeah. So I treatment, and then I got better and I retested. Mm-hmm. But then I could still faintly feel the discomfort. Yeah.
And I just want to interrupt you a little bit to just give our listeners insight on what H. pylori is. H. pylori is a kind of bacteria that lives in your gut, that's in your gastrointestinal system. And sometimes when you have an infection or a positive test, it could cause discomfort, which is primarily pain, like gastrointestinal pain or stomach pain in layman's terms, So that actually is kind of like a signature symptom in addition to other things like, diarrhea and all of that. So that's just perspective. So she did that test because she still kept feeling pain and it came out positive. Yeah.
So I took the treatment and then I retested and then it was negative. But like I said, I was still feeling the faint discomfort.
Mm-hmm.
So I went back to her and she said, well, how about we take a look at GERD? And she prescribed me medication for GERD.
Yeah.
At this point, I felt like, so based on my research, I felt like, because I have to take an antibiotics for the H. pylori. And antibiotics has a way of doing something to your system.
Mm-hmm.
So I felt like, do I really want to keep taking medications for the rest of my life? Now, in the case of GERD, I wasn't tested.
Mm-hmm.
So it was just like, let's try this medication and see if it helps. So I said, okay, how about I research about foods that, gives you that feeling?
Yeah.
I did the research and I avoided those foods.
Right.
And then the feeling kind of went away.
Right. And I wanted to interrupt to give perspective as well, because our audience, some of our audience, they don't have the healthcare background. So it's always important to try to explain the meanings of this thing. So GERD, in other words, it's closely related to reflux. So when you have like reflux or, heartburn, those are just, from a healthcare perspective, it's not like the same thing, but they're extremely similar. So, but in common man lay terms, I would just say, think of it as heartburn and reflux, gastric reflux. So when you have any of that, you have that discomfort in your stomach that you just want to, like, you keep burping and you feel like the food is coming up, or you have heartburn and all of those things. So that's basically what GERD is in layman's terms.
So I avoided the foods and then the feeling was gone for a little bit and came back. And I went back to primary care. So this time she suggested I do an ultrasound for my pancreas and my gallbladder.
Yeah.
And with the ultrasound, it's not as detailed. So the interpretation was possible pancreatitis, like inflammation of the and possible gallstone. So I went back to my primary care. She referred me for, I think, an MRI.
Mm-hmm.
Now, mind you, at this point, I think I just now got insurance from my job, and my copay was $800. And I'm like, wow, okay. So if I back to the ER story, I also had a copay of like $1,200, and I was in the ER for like 2 hours. I had to do a payment plan for that one to pay it up, but anyway, so hearing this $800, I was like, okay. Hopefully this tells me, something, given how much it costs me. I went in, nothing, no gallstones, no, inflammation of the pancreas. So this whole journey took me about 2 years. This is 2017, 2018. The last straw for me was I was referred to a GI specialist. I went in there. I redid the H. pylori test. It was negative. And his suggestion was that I should do a colonoscopy.
Oh my gosh. Now,
I read about colonoscopy and I was like, Lord Jesus, it's been 2 years. There's got to be a way out of this. So in my research, now I was leaning more towards like more scientific like research, not so much personal stories. Even though the personal stories were helpful, I feel like the health journey is different for different people.
Yeah.
So I said, okay, I'll hold off on the colonoscopy and let me change my diet, my lifestyle pretty much. And in my research, I came across chronic inflammation. It's pretty much the underlying cause of a lot of medical conditions, including fibroids. So I learned about how to, limit or eliminate certain things and increase the intake of certain things. And 2 years later, I started to feel like myself, even though the bloating was still there.
Right.
And I was like, okay, I know I've lived with the bloating for a number of years, but 2 years later, this whole discomfort is no longer there. I know I can live with that for that. So the lifestyle change is kind of what I would say, helped me manage the symptoms, because I also read that fibroids can cause gastrointestinal discomfort.
Yeah.
Depending on where it's located and depending on the size.
Yeah. Yeah.
So that change, I would say, has been the most help or the most relief I have received for me, to the point that, and also losing weight, because not like I was obese, but American BMS standard, I was overweight. But it was harder to lose weight because the foods that we eat, especially for women, increases our hormones.
Yeah.
And fibroid, I'm not licensed to diagnose, but I have read too many books to count, like books from medical doctors, I have attended, seminars about food and all of that.
Yeah.
So there is a hormonal imbalance linked to fibroid, as well as other conditions women face, from PCOS to endometriosis and all of that.
Yeah.
So learning about that helped me to make certain changes.
Yeah.
To manage the condition.
Right.
So I would say that that's one thing that has helped me manage the symptoms and sort of slow the growth.
Yeah.
And earlier this year, I did the follow-up, ultrasound. And when the doctor was reading the results, she said, there's a little shrinkage, but you still need to get them out. And I told her to repeat, because I had not, it was the results were through, was virtual. So I was like, oh, wait, because that was the first time in how many years I was hearing that they've shrunk.
Yeah. And how big were they before, when you were diagnosed in the ER?
Well, I don't remember exactly what size they were in 2014, but in 2019, there were 3 large. There was a 10 centimeters, no, 9 centimeters, 7 and 5 point something. And then when she read it, the 2 big ones had shrunk like a centimeter or so or more, but the smaller one had not shrunk. And to me, that was sort of like a relief that whatever it is that I'm doing is either helping manage it,
right,
or slow the growth or shrink it.
Right.
And I literally cried. Like, I was like, whoa, because it's been challenging, especially the week leading to my period and the week of my period. I go from having a 6-pack in 2 weeks to looking 6 months pregnant.
Right.
It's like I'll wake up one morning and I'm getting ready and I'm, oh, wait a minute, what happened? Then it clicks that, oh, you have fibroids when you're bloated.
Right.
So it's like talking myself through. I'm like, oh, it's 2 weeks, you'll be fine. Oof. I'm just tearing up thinking about it.
I know.
It's been so uncomfortable, to the point that, say there'll be an event and I'll be like, oh, give me the date, because I have to look at my calendar and see, okay, where does this fall on my cycle, and see if I can handle, because sometimes it comes with so much hormonal imbalance that oof, I just don't want to be bothered. I want to be left alone.
Yeah.
If the event happens to be the week prior to my period or the week of my period, I'm just like, you know what? Let's see how I feel on that day. And if I can make it, if I can't make it. Now, I really didn't tell people why. Couldn't. I just would not show up. Now, if somebody asked, I'd be like, oh, I was just tired. And I think that one of the greatest challenges, especially with women, is that there's the assumption that, or other women looking from the outside. When I say, oh, I'm tired, and they look at me like, why are you tired? You're not married. You don't have kids. So why are you tired?
Right.
So I'm like, I get it. I get that having kids is exhausting, but you don't
There's more things that cause tiredness than having kids, obviously.
You don't know what people's lives are like for them to feel. So it got to a point where I wouldn't even say I'm tired. I'll just say, I won't say anything. I'll go to events, show my face, and just disappear. And then they'll be like, oh, we didn't see you leave. I'm like, well, I had to leave.
Yeah.
I stopped trying to explain why I couldn't show up or why I couldn't leave. And in as much as I deal with those challenges, one thing I find, or one thing I tell myself is, because I read other people's stories, right? And their symptoms are so bad. I'm like, whoa, like I don't have pain. Like I don't have pain with it. I only have the bloating and the discomfort and the discomfort is almost like I feel like somebody is squeezing me.
Yeah, the
Like
tightness.
yes, that's what I feel. And the tiredness, of course. So I get so tired so easily. And then when I'm not, like the 2 weeks, away from the period, the week before and the period week is, I have so much energy to the point that, because I do fruits on the side, because of the benefits fruits have been to me, I do it on the side for events. And I will pick up a watermelon with one arm, and drop it. Yeah, I will haul 5 watermelons up 3 flights of stairs. I have that energy. But when it comes to that period, I'm just looking at people even talking too much.
Yeah, exhaust you. Yeah, yeah.
But
that's interesting. I should have said this disclaimer at the start of the episode, which I forgot, and I apologize for that. But I just want the audience to know that whatever we share here is based on personal experience. Even though we both have healthcare backgrounds, we're not professionals in the field. We're not OBGYNs, we're not gastroenterologists, we're not endocrinologists, or whatever field or specialty that's related to any of this diagnosis or discussing this. So this is strictly based on personal experience and research. And so take that and apply it to your own life, knowing that it's based on someone else's experience. Now, I also said that to ask you this question because you said, you did some lifestyle changes. So what specific lifestyle changes did you do? Like what foods did you eliminate? What foods did you feel like were helpful to you? And what foods have you felt like, have restored your energy or at least improved your symptoms?
Okay. The broad food groups I had to eliminate include meat, red meat especially, chicken, and fish if it's not wild caught. And dairy, cheese, yogurt. Now this is based on personal, not scientific research, but there are reports that egg yolk.
Yeah, the yolk of an egg. It has a lot of
pretty much animal products because they are raised with hormones, especially in the US. When we consume them, be it male or female, it influences our natural hormonal balance. But it's more in the case of women because our hormones changes throughout the month.
Yeah.
So if you're consuming artificial hormones from animal products, it does that thing. So the broad group is animal-based product to eliminate. And then processed foods and carb, white bread, white pasta, processed meat, ham, salami, and all of that. Yeah. So that's the broad group.
Yeah.
Then you have sugar, artificial sugars, artificial sweeteners. Those are the things I have, which is challenging because I feel like the early, when I first had the low blood sugar thing and I was, feeding off of Kit Kat was my favorite. Ooh. So I kind of feel like I developed a sweet tooth that it's hard to completely eliminate those things. Now I don't buy them, which is how I am able to discipline myself. But if I happen to be at an event, there was a birthday party that, how can you not eat the cake? Now, sometimes I won't eat it.
Yeah.
Sometimes you know what? I just want a sugar.
Yeah.
But the thing that I have learned over the years with eliminating or limiting these things is that when I do get to eat this cake or sugary thing, the moment it hits my tongue, it's almost like my whole body kind of like shrinks.
Yeah.
It's almost like when you stay away from certain foods for so long,
then
you eat, it's like your body is talking to you, like, you shouldn't eat this. This is what's going to happen. So it's been that, challenge of, avoid it, then you eat it, then it's like you drop and then you come up. And there have been some months that I'll be so good that I won't feel as bloated. And I'll be wondering, oh my God, what's happening to my hormones? Are they balancing out? Because I've been so used to being uncomfortable or imbalanced to the point that when I get to the week prior to my period, the week of my period, and I'm like, oh my God, what's happening? It's been a roller coaster kind of journey.
Right. Thank you so much for sharing that. And that's basically a familiar diet that I have also read about in terms of, just improving diet to improve the outcome of fibroids, because as we speak, based on my own research, and I believe also based on facts, there's really no specific cure for fibroids per se. And I feel like, even the diagnosis and stuff like that, your story that when you spoke about, the first time when they said, well, not the first time, but when you went to the ER and they were talking about appendicitis, that's really familiar because I've spoken to someone again before who actually was misdiagnosed as having appendicitis to the point that they actually went and operated upon her. I don't know if you've listened to her episode yet, Hilda. Yeah, she was operated for appendicitis and she had fibroids, Even when I was pregnant, I don't know if I had mentioned this before, but when I was pregnant with my baby, because I have fibroids and my pregnancy was considered high risk. I had 2 fibroids, which initially were small, but with the pregnancy and the spike in hormones, they grew because they fed off of those hormones. And so I was being monitored closely, but there was one time when I think I had like a fibroid degeneration, just a little bit, which is one of the most painful experiences I've ever had. Like that pain literally woke me up from sleep and I had to go to the ER when I was like 6 months pregnant. And I was in so much fear. And the first thing that was said was that it could be that I was checked for actually was for possible appendicitis, So I freaked out because I'm like 6 months pregnant. If I have an appendicitis, I would have to get operated upon. What's going to happen to the baby? But fortunately, or I don't even want to say fortunately or unfortunately, but in terms of saving the baby's life, that was a fortunate event because it was just a fibroid degeneration, which was extremely painful. And fibroid degeneration typically happens during pregnancy when, let's say, with the hormones and everything, the baby feeds off of it too. So it's like the baby fighting with the hormone. My little trooper apparently was sucking out all the food. And when the fibroids are starving, then they start dying or degenerating, That's just the easiest way to put it. So, but that's extremely painful. And that was a scare that I had when I was pregnant. It's one of those things that it can easily be misdiagnosed for appendicitis. And a lot of women have probably been operated upon or misdiagnosed, So it's a very complex disease that even in current times, a lot of health professionals still have that difficulty trying to put their hands on like the cause or the treatment, because of treatment apart from, like just opening you up to take it out and stuff like that, which does not necessarily mean that it's treated. It could still grow back, Yes. So that's one of the struggles that we face. And because of all these gray areas, that's why I felt like it was very important for us to have this conversation and talk about it. Now, when was the last time you had your last scan and what was the outcome?
So that was March of this year. Mm-hmm. And that's when I learned that for the first time since 2014, they were shrinking. Mm-hmm. But before that, I had it the year before, and they were pretty much the same size.
Yeah.
Because my primary care recommended I do scans every 6 months to 1 year just to monitor it. Mm-hmm. And each time I always ask for a copy of the results, because when I did the one last year, because I felt like I had really put a lot of effort into my lifestyle change last mm-hmm. year. And even though hearing that they had not grown was positive, mm-hmm. I still felt like I wasn't doing enough. Yeah. And, beating myself up and all whatnot. And at the beginning of this year, I'm like, okay, what's one more thing that, I can try? What's one more thing that I can do differently? And stress actually alters our hormones, and hormonal imbalance mm-hmm. is linked to fibroids. So I made it a point to, because it was amazing to learn about the things that we think that they're everyday life, but they're actually stressful. Mm-hmm. Something as, in fact, it's hard to figure it out off the top of my head, but something as simple as deep breathing, it helps you
relax. Yeah, it helps.
I actually learned that, when work gets stressful, I kind of tense up and I hold stress, around my neck mm-hmm. and all of that, and then learning to release that. Another perspective I came across, like I said, I'm not diagnosed, or anything of that sort, is that there is the school of thought that as women, we tend to carry kids or carry the mm-hmm. family. So that mm-hmm. whole emotional pent-up energy mm-hmm. that we don't know how to express it,
Yeah.
it's stuck within us. And that kind of took me back to my initial thought about fibroids only happening in older women, because
Yeah.
the story I had heard was that when women are done having the kids that they want to have, they still have these hormones going through them. And because it's not going towards, making a kid, it just collects in there and, forms whatever it does. And I've actually gone into a lot of natural health or natural healing thing. And one thing I learned is that the liver is actually kind of your brain, kind of your second brain.
Yeah.
And
it's like the powerhouse of the body. Yeah.
you have to optimize the foods that we eat, either overwork the liver and make it hard for it to eliminate toxins. So it just stays in the body. So one thing I learned about fibroids is that people with fibroids, not all, in most cases, they have high estrogen. And the liver helps to excrete the excess. But then if we feed our liver with less optimal food, it's not able to excrete it. So it stays in the body and then it causes whatever it causes. So something I learned was castor oil packs, which I actually heard one of your guests in some episode talking about the benefits of castor oil packs.
Yeah.
To help, help the liver excrete excess estrogen.
Wow.
Like optimizing the liver, not only for fibroids, but a lot of health conditions, which is actually what led me into my my passion project, which is, educating people on the benefits of the foods that we eat and how it impacts our health and how you could pretty much reverse most health conditions, especially like diabetes. You can reverse your diabetes. Not to say that you don't need medications for it. You can be on medication, changing your lifestyle.
You could change lifestyle habits. Yeah.
Really gone off of medications and be able to manage their lives without, there was a lot.
Yeah. Yeah. Thank you so much for sharing that. Actually, I was going to, just ask about the passion project and, also before that, I was also going to ask about, what advice will you have for other women that are facing these issues, which you kind of like bundled potential responses to both questions in one. But is there any other additional information or any message that you would like to pass or share with the audience?
I think that we have to be our own health advocates.
Yeah.
Meaning that, yes, you have to seek for professional help and also do your own research and ask questions from a point of wanting to understand better, not so much to want to prove a point. Because, when I say this, I think back to my own experience of, asking questions. I'm like, okay, what does this mean? How does this present itself? What can I do differently? Or it's because I know that some healthcare providers don't want to hear that, Google said that. No, you can't compare somebody's professional education with a Google search. No. Yeah. Just ask, say, okay, what do you think about this? Right? Without necessarily mentioning that, you went to Dr. Google. And for the most part, our healing is really in our hands, right? So even if you decide to do medications or do surgery in this specific condition, like you said, they go back, which means that there is an underlying issue that has to be addressed in order to prevent it from going back or slow the growth of it. Yeah. There are some women who end up having, some stories I have read where doctors would be like, the only solution to this point is to take out your uterus. I don't know about that, but now in certain conditions, right? Like Viola Davis, I haven't read her entire book, but I came across a little snippet of it where in some cases it is life-threatening.
Yeah, it's life-threatening.
You had to take the uterus out. Now, I feel like, I don't know if she had the option to, visit lifestyle changes. I don't know that. Yeah. But I feel like because for me, my greatest fear is that, like with the whole appendicitis thing, my fear was that what if they opened me up for appendicitis and it wasn't appendicitis?
Right.
Right. And I want the option of trying natural health, and not so much is being spoken about lifestyle change.
Yeah.
It's always like, take this medication, you should be fine.
Yeah.
Now, my understanding of medication is that it numbs the symptom.
Yeah. It's like a Band-Aid, right?
Some cases you might need to numb the symptom for a little bit in order to understand the underlying cause. Then you do the lifestyle change and then maybe get off the medication.
Yeah.
But to just be on medication for the life of your life, it's almost like medications do have side effects.
Yeah. Yeah.
So they build up and maybe create a different thing that you need medication for. And this is like a ripple effect.
Right.
So, and I'm not saying this to say that lifestyle change is any easy. No, it's not.
That's true.
And sometimes, because I love chocolate, like I have a sweet tooth, I put it out there. Sometimes I'll just be like, you know what, this one day, because the thing with the hormonal imbalance is that sometimes it's so bad that I just want to curl up in the ball and stick to it and then wake up and that's what another thing too with that too is anemia,
Yeah, because it's your blood. So you have low blood levels, iron levels.
Most people who I'm kind of close with, they know when I get into any house, two things I look for: a couch and a blanket. Right.
Yep, I'm always cold too.
But the funny thing is that when I do my blood work, I'm not anemic. It's not sure. Well, this last year it showed anemic for the first time, but then I got on iron pills.
Right.
And then I redid it. The iron was up. So now I looked for foods that, help improve your iron.
Yeah.
That's what I feed off, just so that I don't have to, be on medication for the rest of my life. But either way, I could think back to, times where I'm just cold. I can't explain why I'm cold. And people always be like, oh, she's always sleeping. She's always wrapped up in the blanket. But like I said, I didn't feel like explaining why. Because after dealing with, family, we're like, oh, you might not have kids, and blah, blah, blah. I don't hear it from anybody else. That incident, I walked into, there was a house party. Now, around my period, I tend to wear loose-fitting clothes or black, even when I'm not on my period.
Yeah.
Like, it makes me feel like I'm constricted. I want to feel loose. So I walked into this event and this girl said, what are you hiding in there? Now, my initial thought was to say, oh, it's not your child, it's not your relative. Like I wanted to get back at her for her to feel the way that I felt by her comment.
Yeah.
But I said, well, it's not like it's your brother's child or your boyfriend's child or your father's child. Like I have the ability to get, it's not usually needed, but sometimes that's what hits me first.
Yeah.
But then again, I'll just say, I'm just bloated, that's all. But because it's almost like it's a normal thing to be bloated, which is not. Because if you don't have fibroids, other things like gut bacteria imbalances can cause bloated, which is not a normal thing. That's a topic for a different day. But society has normalized women being bloated, but it's not okay.
Yeah. And we can also talk about so many things that society has normalized, but I'm glad that we had this conversation because it just goes to show that we need to talk more about this, right? We need to debunk all of these ideologies that are false and hurting women emotionally, mentally, and psychologically. We need to keep having conversations like this because it's needed. In as much as it's common, it's not usually or typically spoken about. And that's why we're making an effort actually to talk about it. Now, how can our guests reach out to you if they have any questions or if they want to support any projects you're passionate about?
Okay. So I am only on Instagram. Instagram is the only social media I'm on for now. So my personal is Miss Nane. And the one where I talk more about health. Not really. In fact, I don't think that I've really ever spoken about fibroids on that page. I share other people's information about fibroids, but and also other health conditions, anything. mental health, is influenced by what we eat and everything from a simple headache to a wound healing. So on my Nana's food page, that's where I mostly share that information.
Mm-hmm.
And also another project I am passionate about, which is not really mine, but it's a friend's. It's called Generosity Global.
Mm-hmm.
I joined, I became like a volunteer in 2014.
Mm-hmm.
And funny story is that I was away at grad school, I actually went to grad school in that state because I was running away from family, all this pressure, get married, have kids. So I didn't want to hear it, So I felt like, being out of sight, I hear it less. So in that isolation per se, I just, one day in my room, I was like, God, show me how I can be part of something bigger than me.
Mm-hmm.
And then there used to be this book club that used to happen by phone. So I hopped on the book club, and there was this guy talking about, it's what he does in the community, which is feed the homeless every month. I think second Saturday of the month. It only happens in Maryland, Baltimore.
Mm-hmm.
So I was sharing. That kind of spoke to my heart.
Mm-hmm.
I became a volunteer in 2014. Every year he has an annual fundraiser, with the money goes towards building wells in African countries, providing water in areas that there is no water.
Mm-hmm.
So initially it started off as Selfless Saturday, a friend to the homeless. So they provide resources, food to people who are homeless in the Baltimore area. Then it merged into providing water, mostly in African countries. And recently it became, he added, so his wife, so his name is Rich Aqua, and then his wife is Erica. So they added a different branch, which is Generosity Global Women. Actually, this shirt I am wearing is from that. It says there's purpose behind it, period. Now, this one actually speaks to me personally because for women with fibroids, in certain cases, you have like heavy period, right? So when I attended the recent, I've been attending every mission ball since 2014. When I attended the recent one where he talked about how they were training, teaching women how to make reusable pads, it was kind of heartwarming because it made me wonder what women in that part of the country who don't have access to sanitary products, who may be dealing with fibroids and have heavy bleeding, and they don't have, So this project actually provides that for them, even if they don't have fibroids and they're just having the normal menstrual cycle. So this one is actually, it actually, it speaks to me personally, and I feel like it's almost like, well, this is my personal opinion. I feel like sanitary products should be free in the US because as women we choose to, have a period every month, so we shouldn't have to pay.
You have no control over it, right?
That's the story for a different day.
But at least it should be covered by insurance.
Exactly. Yeah, because those things are expensive. Because one change I had to make too was switch from using generic periods to using generic sanitary products to using organic, because another research I came across is that sanitary products, especially in the US, I don't even know if I want to say this, but it has a lot of things in it that is not safe for the body. Let me put it like that. Like if you read the ingredients or whatever it's used to make a generic, I don't want to use any names because generic versus organic or made by a woman, the stories behind it, you tend to, and I can say that I feel a difference, when I switched from generic everyday periods, sanitary products to, and it's not cheap, but the benefits I feel health-wise, and like I say, insurance should be paying for that too, because this is a lifetime thing, or it's a number of years of having to go through that.
Yeah.
It should be covered.
That's true. That's really a food for thought. But thank you so much for sharing all of that. And I hope that you can share that information, like everything you've shared with me, your contact to, projects you're passionate about. And we're going to add that in the show notes for this episode. Now, I really, really want to thank you for sharing your story. Your voice is very needed. Your voice adds to our attempt to keep these conversations going. And I truly appreciate you taking out your time to speak about your experience. It's not the easiest thing, especially in the African community, but I'm glad you let it out. And I really hope that other women in our community can be inspired by your story and understand that they're not alone, and also try to keep the conversation going either on this platform or within their circles. So I just want to really thank you. I don't know if you have any last words to offer before we round up.
First, to really thank you for this platform, because like I said, there's like, for people who know me personally, I seldom talk. I'm always the listener or the observer. But after, just from the title of your podcast, when I first listened to the first episode, I don't remember what episode that was, but it spoke to me. Like, I have a story. I mean, I have stories in different aspects of my life, but I felt like this particular story is what I need to get out there. And just from the title of your podcast, it made me want to share that story, which, like I said, you might be the second, besides my immediate family.
Yeah.
You're probably the second person to hear it from me. And also, just listening to the other interviews, something I've also learned in reading is that some people only share their stories with people that they have found that they can handle the information. And I must really say that, like I said, I'm an observer. I have a psychology, undergrad. You make it easy for people to want to share their story, right? And I listen to a bunch of podcasts, by Africans, by Cameroonians. And for whatever reason, I felt like if I wanted to get my story out there, your podcast will be the platform that I want to get that story out there. And that's when I reached out to you. And in a different aspect, there is another thing we have in common, which is a sibling with disability.
Yeah.
So I felt like there is a lot of connection there.
Yeah.
So there is a to want to share this story. And I don't know for other people, but listening to the other stories about fibroids, I was like, oh, wow, people really have it challenging. Like when I listen to other people's stories, I'm like, you know what? Yes, my challenge is my challenge, but there's a lot to be grateful for. Like I said, I don't have any pain.
Yeah.
No pain.
It's all about perspective, right? Yeah. Yeah. Well, thank you. Thank you so much for your very kind words. I am really honored. And, there are days when I really get discouraged and I'm like, oh my God, I'm going through so much. I need to just not do this anymore. And then people like you show up and give me another reason to keep going. So I really want to thank you so much for saying that. And thank you for the encouragement. Thank you for, choosing this platform to share your story. And we don't take that for granted at all. I am super honored. And I hope that when other people hear your story, they can have the same feeling that you had when you heard another person's story on this platform. And like I mentioned the other day to you, I was trying to lay my hands on the connection that we have. And boom, it was that mutual experience that we have with, having a sibling that has a disability. So, I was just thinking, I'm like, maybe someday we can talk about it again. It's such a heavy topic. I don't, you need to prepare yourself extremely. You have to really prepare yourself because it takes an extreme emotional toll on anybody after, talking about a very heavy topic like that. But I'm glad that that topic inspired you to even start your own conversation in your own circle. But I just want to thank you again so much for coming on here. And you're always welcome to share whatever story that you want. Okay, so I want to thank you and I thank the listeners for listening, and I'll catch you in the next episode. Bye.
That's it for today. Thank you for listening to our show. If you want to participate in the show or find out more helpful resources, then visit www.livingafricanpodcast.com for more information, or email us at hello@livingafricanpodcast.com. Also, don't forget to connect with us on all social media platforms at Living African Podcast. You can also connect with Anyo directly on Facebook or Instagram at Anyo Fambad. Thanks again for listening, and let's not forget to be more understanding and nicer to one another.